Hi, Dr. Yass here. And in this discussion, I want to review a case study, an exact example of why, to be very honest, the trust of the medical system has been called into question so severely that I am hesitant for anybody to accept a diagnosis provided without the opportunity to fully evaluate the symptoms present and to confirm whether there is a structural cause of symptoms or a muscular cause. In this particular case, a gentleman who just came to me was told that the pain at his foot and the level of dysfunction, his complete inability to weight bear on that foot, was due to a fractured bone in his ankle, and that a total ankle replacement was necessary. He was going to be getting this at the end of this month. And due to a particular incident, I came back in contact with him, which led him to identify the fact that he was going to be getting this total ankle replacement. And because of my severe fear in the type of diagnoses that are provided and the level of baselessness of these diagnoses, I felt compelled to have an opportunity to evaluate this guy. So, quite remarkably, he was willing to travel 3 hours, drive 3 hours to my facility, then have his session, and then drive 3 hours home. That's how significant he felt the value of a Yass Method evaluation is. So he came and he was wearing an ankle brace, and you could see that his foot was so pronated, so bent to the inside that even with his shoe on, the shoe on the inside was incapable of supporting the inside of the arch, and the inside of his foot was almost touching the floor. And that was with the shoe and the brace on. So I asked him to take the shoe and the brace off, and I evaluated his foot. And sure enough, you could see that instead of seeing the midline of the foot in line with the midline of the lower leg, the midline of his foot had shifted so severely inside or medial to the midline of the shin that showed that he was fully weight bearing on the inside of his foot. He was no longer weight bearing through the middle of the foot. It was all on the inside of the foot. So he told me about this concept that he has this fractured bone. So to me, if he has a fractured bone, it would be evident that if in fact the bone was creating the pain, he should have continuous pain regardless of weight bearing. It should be continuous because a fracture is a fracture, and the level of intensity of pain shouldn't vary very much. And yet he said he had absolutely no pain other than weight bearing. So it leads to the question of either, number one, which I would be horrified to think, that in fact he does not have a fractured bone and that that's just a lie, or that a fractured bone was identified, but it's just a degenerative fracture. It's something that's occurred over a period of time and in fact is independent to his pain, the cause of his pain, and it just exists and therefore warrants no additional type of intervention, which means that the whole basis for the ankle replacement is invalid. I then asked him to stand on the foot, and sure enough, as soon as he stood, it just collapsed. He was literally weight bearing almost completely on the inside of his ankle, not even the foot. So I asked him to walk, and boy, it was just an extreme hobble. He could put no weight on it. He told me that at this point, he lived in a house that if he tried to walk to the next house, next door to his house, he could not. The pain was just too great, and the level of loss of function was so extreme. He couldn't even walk one house. And I think what was most saddening to me was the fact that this guy had bought a motorcycle, and that he's retired for the one of the key reasons was that he can ride his motorcycle whenever he wants, and he can't ride it at all because he can't use his foot to change the gears. So literally, the motorcycle has been sitting in his garage for months. So I then went on and kind of checked the range of motion, and you can see that the ability to bring the foot towards the outside, towards the to actually bring the outside of the foot towards the inside had been limited because there's a strap muscle that sits at the outside of the shin and wraps around the outer ankle to the underside of the foot. And that had been so severely shortened because of the pronated foot, the collapsed arch, that it was limiting range of motion. So his foot always had that flattened portion on the inside, and basically he couldn't bring his foot in. He could not invert his foot. So I end up massaging that, and then I massaged his plantar fascia and some of the tissues on the underside of the foot. And then I kind of did this mobilization of the foot. I kind of just started to stretch the different muscles surrounding the ankle. And before you knew it, he had very, very good inversion again. He was able to actually supinate his foot, is what it's described, which is to enhance the level of arch in the foot. And sure enough, the outer portion of the foot was able to come right across the midline, and he had the inversion. And he was stunned because he hadn't seen that capacity of his ankle to make that motion in months. And then came the magic, which is where I said, okay, well, now stand up and weight bear on it. He weight bared it, and he just freaked out. He started crying. He's like, I don't have any pain. And he just started walking, and he walked without a hobble. And he said there was an ever so slight level of soreness, but it was nothing that would impede him from being able to walk as far as he wanted. And it was obviously an emotional situation because this guy had been resigned to this idea he was going to have to get this horrific surgery, which, to be very honest with anybody, I'm not aware of a single successful ankle replacement. I have never heard of one being successful. And in fact, this guy was told that he might, at the end of the ankle surgery, be able to bring his foot up and down, but they were going to fuse him to prevent him from moving side to side. And with that understanding, I mean, by definition, if you don't have the proper biomechanics of the ankle, you don't have a normal ankle. And if you don't have a normal ankle, at some point, you're going to end up with pain at the knee and the hip at some point. So it was almost kind of a self-inflicted failure of normal function of the ankle after the surgery, which was going to prevent this guy from ever having normal full function. Then we did a series of 4 exercises, just 4 exercises. And I strengthened his hip muscle, the muscles that support the inner ankle, his butt muscle, and his hamstring. And by the time we finished the exercises, he felt remarkable. Function was great. If you looked at his foot, amazingly, in less than an hour, his foot was reoriented to where he wasn't in a pronated collapsed arch. He had a bit of an arch, and his foot, the center line of his foot, was now directly under the center line of his shin. And he just walked out without his brace on, no pain. He subsequently called me after his 3-hour trip home, which could have been a problem, and he said, I have no pain. And he was incredibly thankful, and he'll sustain the exercises. He'll never get the surgery, and he'll have full function. And the lesson here is that you've got to be very careful who you're getting these diagnoses from. I have no idea how anybody on this planet, based on the presentation of this guy's symptoms and his ankle, why anyone would have suggested he needed an ankle replacement. Almost suicidal. It's insane. There would be only one reason I could think of that someone would require a total ankle replacement, and that's that they got in some sort of horrific accident to where the bones of the ankle had fractured so severely that they were no longer able to be returned to their normal capacity, that their normal shape and position, and that the ankle basically became inoperable due to the surgery, due to the incident, the accident, or the trauma, whatever that might be. But other than that one particular type of reason, I have no understanding of why anyone would ever promote the idea of getting an ankle replacement. And with that understanding, and in this example, it's quite scary to think that There's hundreds of thousands of people out there right now who are being told they need this ankle replacement based on, again, some wacky X-ray or MRI, and some person who is telling you that you need this without having any way of having some sort of verification mechanism, some alternative view that allows you to determine whether what this person's saying is valid or not. So my strong suggestion to everybody out there who's being told they need an ankle replacement is to get a Yass Method treatment, whether it's in person in Jacksonville, Florida, or whether it's by Zoom. For God's sakes, please don't get an ankle replacement if it's unnecessary. And you won't know if it's necessary or not until you get a valid physical evaluation, which allows the present symptoms and the physical presentation of your ankle to be understood. And that's simply not happening with someone who's simply looking at an X-ray or MRI and telling you, oh, yeah, you need an ankle replacement. So I would strongly consider, based on this case study, that anyone consider, and let's just put it across the board, whether it's an ankle, a hip, a knee, a shoulder. If you're being told you need a joint replacement, please get a Yass Method treatment session so you can get a proper evaluation and determine, based on the presentation of symptoms, whether this is a valid diagnosis, which, in my opinion, 95% of these are not. So consider getting that Yass Method treatment session as soon as you can, and let's come to a legitimate diagnosis, the legitimate plan of action. In 98% of cases, I found the cause of pain to be muscular, which is great, even when structural abnormalities are identified on diagnostic tests. And this allows that person to do 3 to 4 exercises 3 times a week, understanding how to progress resistance to be able to resolve their pain and achieve full function of weeks. Who doesn't want that? So if you think this video was helpful, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe and hit the bell icon to get notifications when new videos are added or to know when I'm live on YouTube. If you would like to contact me by email, do so at drmitch@mitchellyass.com. If you would like to schedule a Yass Method treatment session, you can go on my website, Live Without Pains, that's plural, livewithoutpains.com. There's a schedule now button. Schedule your appointment for the day and time that works best for you, and we can move forward and help you achieve pain-free and fully functional. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.